To confirm that you're on the right track, you say, okay, patient has both evidence of pericarditis and myocarditis. The pericarditis is the diffuse ST elevation. The myocarditis basically is inflammation of the myocardium, right? So now the problem is you have to know what is the family of the virus. Is it a toga? Is it paramyxo? Is it flavi? What is it, right? So here's what happens. You have your first aid. Here it is. You have the viruses, the RNA, and the DNA. I've shown you this before in micro. I also go extensively in this in my QBank video library, so you guys are aware. When you're doing the viruses, which I usually do in micro, you'll realize all the RNA are all single-stranded but one. Which one is it? The first one. The first one's double-stranded, right? I also have shown you, when you look at first aid, look at this. Picorna, RNA, the name RNA is in it. And if you see something like this, like a mnemonic, it's actually pretty important to know. Because I don't know about you, but when I see perch, I always think of polio, echo, rhino, which is the cold, common cold, Coxsackie, which is many, many conditions, including myocarditis and pericarditis, and HAV. So it could be intimidating. But when I show you this in my micro section, I go extensively into this material. So it makes it easier for you because you are responsible to know RNAs and DNAs, right? Simple. You can't run away from it. So if you go back to the DNA, make it simple for yourself. You say, okay, how do I get to know all of this information? Consolidate and make things simplify everything. All the DNA is what? They're all double stranded. See, 1, 2, 3, except what? The last one, single strand. Oh, if you're about position, which I am, I'm very visual. I think a lot of you guys are visual too. If I see something, I remember it. So in the beginning of this page here, we have viruses, 1, 2, 3, and the first 3 have envelopes. The other ones, they're naked. If you remember, all the DNA are double-stranded, but one, single-stranded. Then we go down to the RNA. RNA are all single-stranded, but one. This first one's double-stranded. And if you realize, the first 4 are naked, and the other ones are enveloped. So in my mind, I know DNA and RNA. I know which ones are double-stranded, single-stranded. I know which ones are enveloped versus naked. If you don't do something like this, you get in trouble to a point where you know it's myocarditis, pericarditis, and then you're like, uh-oh, what could the answer be? Well, the answer would be it's not toga. Paramyxo is this. Follow the little mnemonics, by the way. I know a lot of you don't like the mnemonics in first aid, but you have to use it to your advantage. Paramyxo, here, P-R-M. P-R-M. Parainfluenza, RSV, measles, and mumps. So it's not any of those. The answer would be picornavirus. So I know it's challenging, but think of it this way. 52% got it right. I know most of you knew it was peri and myocarditis. The problem is we're stuck because we don't know how to move on from here. So when you learn this information, it's up to us as a team to try to conquer most common things in tables like this and make it easy for ourselves. So when you see something like this, I'm showing you how to learn the information in a short time frame. Please don't do this. Watch sketchy, draw it out 10 times, see it 30 times, because I'm telling you, there's so much information you have to learn. You have to practice the technique to make it simpler, to make it simple for yourself. So you said it's all right. Well, RNA, they're all single-stranded but one. The first 4 are naked. The other ones have envelopes. And I always go to this. Reovirus, rota is the most important. This is very important. This is 1, 2, 3, 4, 5 viruses of medical importance under this viral family, right? And you go over here, HIV is important. Paramyxo is huge, measles, mumps. So this is what I mean when you study. That's why 52% got this question right and not more. You knew it was ST, you knew it was pericarditis, myocarditis, but you couldn't get the answer. So peripheral edema, hepatomegaly, ascites. Yes, right heart failure. Okay, fine. We also have a murmur here, guys. We also have a murmur. Holosystolic murmur, heard best at the left lower sternal border, that increases in intensity with inspiration. What do you think that is? This is the first aid. In the first aid, this is one of the most important pictures I've ever seen. I mean, everything is important. But look at this. They give you location, aortic area, right here. Tricuspid area, over here. Pulmonic area, in this region, and mitral area. Now, these are the maneuvers. The maneuvers are important. We have to understand. Now, if you don't understand about preload and afterload, I get it. Listen, I understand. You're in med school, you graduated years ago, they taught you well, the teacher didn't teach well. Doctors could be smart, but they also have to be wanting to teach, right? So I say to myself, if I was doing it again, how would I do it? I could spend videos upon videos learning preload and afterload, sure. Boards and beyond, online med ed, fine. But in this situation, I can know location. I can know where it radiates, right? The sound. And also I could say, well, I could understand the cardiovascular changes. I could understand the murmurs. Basically, when you do certain maneuvers like passive leg raising or squatting or so on. That's why we do heart first, then lungs, and then renal. Heart, lungs, renal. Cardiopulmonary renal, CPR, because the physio is all very similar, right? Yes. Okay. So we say this now, we say let's move back again.